So we have great science and vaccines, but we can't always get people to participate. So what do you think we should be doing to reduce vaccine hesitancy and improve adherence?
Well, I think we've got to be extremely careful in our messaging. We've got to, first of all, not criticize people who have hesitancy, but reach out and say, we understand why you might be hesitant, but let's take a look at the scientific facts and take the time to explain in clear language, not talking down to people, but not talking in the way that's so arcane that they can't understand what you're talking about, and explain to them the risk benefit and pick out the 2 or 3 things that they're concerned about and explain. We do that with the vaccine for COVID-19. People say, well, you've gone too quickly. There must be something wrong there. You must have cut corners. And then you explain, no. As a matter of fact, the speed is related to the breathtaking advances in the science of vaccine platform technology. And safety has not been compromised, nor has scientific integrity, and explain why. And then people say, well, is it really safe and effective? And then explain to them things they don't understand, that the decisions that are made about safety and efficacy go right through a data and safety monitoring board that is completely independent of the government and completely independent of the pharmaceutical company. I just think we need to take the time to explain in clear language that there is a scientific basis for when we say something is safe and effective.
And what can we do to encourage people to go into public health careers?
Well, I mean, I think that anyone who has any interest in medicine, science, and public health is to just look at what is going on right now. I mean, we don't like suffering, we don't like disease, we don't like deaths. But if you really want to get into the action, take a look at what's gone on over the last couple of decades. I mean, we've had pandemic flu, we've had Zika, we've had Ebola, now we got COVID-19, there's the ever-present HIV. I mean, you've got to go with what suits you. We all know that. And that's the reason why we chose what we're doing now in medicine. But if it suits you, I cannot imagine a more exciting thing for a young person to get involved in is in something that relates to public and global health, because the impact that you can have on society is enormous. So just take a look at the impact you can have, and I think it speaks for itself.
You've been an incredible inspiration to all of us throughout the year. I think whenever any of us felt like we were going to lose it or pull our hair out, we often thought back to what Dr. Fauci would do and how you stay so calm despite all of the challenges and continue to be forward-thinking, data-driven, and really pushing the science to protect the public. Thank you very much for your time this morning. We're very grateful.
Thank you. Thank you, Vicki. It's really a pleasure to be with you. Thank you, Bill, for giving me the opportunity to join you today, particularly to pay honor and respect to a great person in medicine, Jerry Medoff.